The Association of Registered Nurses on Prince Edward Island says islanders are too reliant on the healthcare system. That's why it's been holding public sessions encouraging people to take charge of their own health. President Nancy MacFayden says registered nurses should be doing more to build islanders' health confidence. One of the things RNs are currently doing that she'd like to see expanded is offering chronic disease monitoring from community offices. MacFayden says this counseling helps people with diabetes and COPD maintain their health so they don't have to see the doctor or end up in a hospital bed. Island Morning's Laura Chapin spoke with MacFayden more about this issue.
There are pockets of excellence on PEI. We have now almost 10 years of evidence locally how we can have such an improved level of wellness, and these people are engaged in their own health. They know their targets. They want people to help them get there. For example, I'll give you this example of our chronic obstructive pulmonary disease patients. And these patients have been educated. They've been given their own action plan. They've been given control of their own illness. And it's just unbelievably how much those people, their whole attitude and ability to cope with other things in their life has just been elevated to a different level. And if you ask any of those people, they will tell you that.
And they'd show up at the emergency room less.
Oh, there are people that would tell me that, ordinarily they would, because they're at risk to get pneumonia and chest infections, that they would be in hospital probably 2-3 times a year for many, many years. And every time they got admitted, they would be in hospital for a month at a time. And many of these people have not been admitted to hospital now for 2 or 3 years. What we're talking about with the public right now is to try to mobilize the public and help them start thinking in a different way. What can I do to maintain my own level of wellness and give me the skills and the knowledge and that I need to care for myself and my family? It's not about cost saving. Yes, if that person with COPD hasn't been in hospital, it saved, hundreds of thousands of dollars, but somebody else was in that bed. Okay, that person wasn't, but it opened up that bed for somebody else. This is talking about the appropriate resources being used in the appropriate way and given time, elevating the level of health in the province. And registered nurses are the ones that can really support that.
And would you say that RNs are being used the most effectively that they can be in the system as it stands right now?
In short, no. No, they're not. Even though we keep talking for years, having the right person at the right time and the right location, giving the right care and all of that, we really haven't gotten there yet. People don't have access to registered nurses. And access is the number one thing that everybody is concerned about. They can't get access to their family doctor. They can't get access to the hospital bed. So little bit of investment in the right place would solve the whole issue of access for people. When I am sick, I need to see my doctor. That's what we need doctors for, to see. When we need medical treatment, we need a medical doctor. But all of these people who have multiple conditions that are stable and well can be looked after by registered nurses so that the physician does have open appointments and can see the people that are sick on any given time when they need it. So no, we need to maximize this fantastic deep well of resource that's available. We need to make sure that everyone across the province has access to registered nurses.
So what would you be asking the government to do? Like if there was one change that you think would get closer to what you'd like to see, what would it be?
Nurse-run clinics locally in communities all across the province. And that would have such an impact to be able to run programs and everything locally for people, get back to that community nursing that has, through our history, has been so powerful to maintain, health in our citizens. If we had a senior strategy, and RNs, again, are ideally positioned to be doing assessments for seniors in their home, looking at what they need. Oftentimes, it's very small resources that they need to keep them in their home. What did that person need to prevent them, having to require acute care services and nursing services? Is it because they fell and broke a hip? Because they're not eating? Because they need somebody to come in that's going to help them prepare their meals? It is very simple. It is so simple sometimes that it seems like, well, this can't be right. This has got to be more to it There isn't. We have to get back to the basics of all of the determinants of health, safety, proper housing, proper nutrition, proper education, a job. These are the things that determine the level of wellness, not how many hospital beds we have or how many long-term care beds we have.
Nancy MacFayden is the president of the Association of Registered Nurses on PEI. She says it would cost Health PEI $30,000 a year for an RN to offer community clinics doing this kind of work 2 days a week. And Laura Chapin will have more on this story coming up after 7 o'clock, continuing the conversation with Nancy MacFayden. The Association of Registered Nurses in PEI wants people to take charge of their own health. It believes giving RNs a bigger role in public care and education is a good way to encourage this through things like putting RNs back in public schools. The association's been making public presentations across the island. President Nancy MacFayden says she feels strongly that this shift, it needs to happen. Now, Laura Chapin has been looking into this to mark National Nursing Week. Good morning, Laura.
Good morning, Matt. Yeah, the group's president, Nancy MacFayden, says registered nurses should be doing more to build Islanders' health confidence. And we heard her talk last hour about the example of RNs who are in collaborative practices at provincial healthcare centres. One of the things these nurses do is offer chronic disease monitoring. She thinks that should expand to all communities. She'd also like to see dedicated RNs back in all higher level schools in PEI.
We, of course, are very concerned as registered nurses in the province with the amount of money, the proportion of the provincial funds that go to health care, and yet our people are not healthier. You know, there's been many studies done by governments over the past, like this big study that we paid hundreds of thousands of dollars for in the 90s, and then again the Corpus Sanchez studies in the early 2000s and what have you. And they're all saying the same thing, but we're not doing it. We need to have a shift in attitude and thinking across the province where people, instead of thinking about illness care and making sure that there's a hospital bed available for me when I need it, that we need to be changing our attitude and our thinking around preventative things that I can do to maintain my health and to elevate my level of wellness. And we have the resources, we have the people that are already part of our system to help people do that. And don't get me wrong, everybody in the system is working so hard. Everybody at the bedside, everybody at the Department of Health, it doesn't matter what level you are, people are really working hard and trying their best to make sure that we're good stewards of people's money when it comes to health care. But we have to make sure that our energy and our funds are being spent on the proper things. And what we want to do is help the public to understand this, that the public need to know they have to become less reliant on the system. We have spent 40, 50 years educating the public to rely on the system. If you need anything, run to your family doctor. We have to now stop that because we don't have enough family doctors, and family doctors are overwhelmed with the amount of chronic disease and conditions and everything that their patients are trying to deal with. And they need help. They may not know exactly what help they need, but they need help. And so what we want the public to understand, we thought, well, we've been trying to educate the politicians around this for many, many, many years. It's very difficult for them to grasp it. They have so many demands put upon them by so many groups within the system. When you have a complex system like health, very difficult for them to understand. And because registered nurses in the province are so passionate about this, that we really know that we have the knowledge and the skills that can stem this tide, which was the name of one of the projects that Health PEI or the PEI government had to stem the tide. And registered nurses are positioned to do that.
So give me an example of something that's not happening right now that registered nurses could help with.
Right off the top of my head, I look at school health. We always had nurses in the schools for many, many, many years. And now the nurses are taken out of the schools. And we have evidence from across the country and as close to Nova Scotia by putting registered nurses in the schools. So a collaboration between Department of Education and Department of Health. So you're looking at things out of control, type 2 diabetes, which is a preventable illness, childhood obesity, cigarette smoking in youth, all of the reproductive problems that we're getting in the province. So many of these things can be addressed by registered nurses nurses as Johnny on the spot in our schools and in our school systems. And there's many, all kinds of evidence to support that. And this is inexpensive. In the large scheme of things, this is very cheap for very big outcomes. That's one example.
But in that example, I mean, type 2 diabetes, what would you be doing to change that picture at a school level?
Because you're going to help these students right off the bat be educated around healthy living, choices, better choices. You help them identify what things are putting them at risk because they may not realize themselves that they're at risk. We don't get young people coming into the family doctor's offices until they have an issue. They don't come there when they're well to learn how to stay well.
So when I was young, school nurses, you just went to them when you felt ill at school and they checked you out and said maybe you should go home, maybe you shouldn't. Are school nurses being used differently now? Are they actually actively offering classes and doing counseling sessions at schools?
Absolutely. A pilot that they had running in Nova Scotia, they were at the junior high. I think they started at the high school level and then went to the junior high level because they could see the need. They had to start sooner. It was unbelievable. The students sought them out for all kinds of counseling, preventative things. They knew, they started wondering, am I getting into trouble with depression? Then the nurses could help screen them for depression and start helping them learn some coping skills. Because this is the thing that we kind of have a couple of generations now that really don't have a lot of capacity to cope with different kinds of things that are going on with their level of health and wellness because we've made them dependent on the system.
That is Nancy MacFayden. She's president of the Association of Registered Nurses of PEI. And I checked in with the department. Of course, public health nurses do visit schools here in PEI. And I've asked them, what they think of the idea that Nancy's raising to put dedicated RNs back in the schools.
Becca Vio already sending us a note on Twitter saying RNs in schools, great idea for proactive healthcare. Great example of more frontline workers in proactive roles. And if you'd like to share your thoughts on this story, our toll-free talkback line 1-800-680-1898. Our email address islandmorning@cbc.ca. On Facebook it's CBC Prince Edward Island. On Twitter @Island Morning. And a reminder about those late